Have you ever looked at a mirror and noticed that one side of your face sits differently than the other? Not dramatically, not in a way you'd describe to a friend, but when you look carefully, and you have looked carefully, or you wouldn't be here, one cheek seems slightly fuller, one brow slightly lower, the line of one jaw a little softer than the other. You've probably wondered whether it's the light, whether it's how you're holding your phone, whether you're imagining it. You're not imagining it. There's something most people have never been told to check, and once you check it, you won't be able to forget it. Stand up for a moment, or sit up straight in your chair. Without adjusting anything, without trying to correct your posture, just notice where your shoulders are. Specifically, is one of them slightly higher than the other? Slightly more forward? Not by much, maybe half an inch, maybe less. For most people, it's there. That difference, that small, seemingly insignificant asymmetry in your shoulders, is one piece of why both sides of your face have not been receiving equal input from the structures below them. And the structure that sits right at the intersection of that shoulder asymmetry and everything above it is your collarbone. Both of them, not working together, working differently. The question I want to sit with you on today is this: what would happen if for 60 seconds you gave both of your collarbones the same mechanical starting point? Most of the conversation about facial symmetry lives in the face itself. Massage here, lymphatic drainage there, gua sha on the cheekbones, exercise for the jaw. Some of those things have their place, but the face doesn't float independently of everything below it. It's attached. And the question of why it's attached unevenly on the left versus the right, why the soft tissue on one side of your face hangs differently from the same bone on the other side, that question almost never gets traced back far enough. The anatomists got there first, which is where I want to start. In the dissection rooms of European universities, before there were imaging machines or computational models of human movement, the people who mapped the body had to follow what they could actually see and touch. The fascial system, the continuous web of connected tissue that surrounds every muscle, every nerve, every organ, wasn't understood as a continuous system for most of medical history. The assumption was that a structure in your calf was essentially unrelated to a structure in your cheek. They were in different anatomical regions. They had different names, different textbooks. What the careful dissectors kept finding, though, was continuity. Not in a metaphorical sense. Physical continuity. You could follow a plane of tissue from the plantar fascia of the foot, up the back of the leg, through the thoracolumbar fascia, up the back of the skull, and over the top of the head, all without lifting the scalpel. Thomas Myers spent decades documenting these lines, what he eventually organized into the framework called anatomy trains. In one of the lines that gets the least attention in popular conversation is the one running along the front of the body, the superficial front line. It originates at the top of the foot, runs up the front of the shin, through the quadricep, up the abdomen, and then, this is the part that matters for this conversation, it connects to the sternocleidomastoid to the skull. In the anchor point of the sternocleidomastoid, the place where it grabs onto the skeleton before running up the neck to the skull, is the clavicle, your collarbone. There's a second structure worth naming here, and it's one that rarely gets mentioned, the platysma. It's a thin, broad muscle that lives just under the skin of your neck and lower face. Surgeons know it well because they have to account for it. The platysma's origin sits along the fascia of the chest and shoulders, within a few centimeters of your collarbone's superior surface. It runs up through the neck and attaches into the soft tissue of the lower cheek, the jaw, and the corners of the mouth. When the structure it originates near sits in a different position on your left versus your right, when one collarbone is chronically a few millimeters higher and more forward than the other, the platysma on that side is under a different resting tension, a different vector of pull. And that pull transmits upward into the lower face consistently, every hour of every day, year after year. This is not a fringe idea. Robert Schleip, whose work with the European Fascia Research Congress helped bring fascial mechanics into evidence-based clinical practice, has documented how fascial tissue responds to sustained mechanical input over time. how a structure under consistent asymmetric loading eventually adapts its resting state to accommodate that load. 2 or 3 millimeters of positional difference at the clavicle sounds like almost nothing. At the collarbone level, it is almost nothing. By the time that positional difference has transmitted through the platysma and into the soft tissue of your lower face, it has been amplified by every centimeter of tissue between them. Now, your collarbone, both of them, separately, is doing something you've never been asked to pay attention to. Run your fingers along the top edge of your chest, just below your neck. You'll hit a horizontal ridge of bone. That's the clavicle. Start from the center, where it meets your breastbone, and follow it outward to your shoulder. Feel how it rises toward the shoulder. Feel how it changes direction slightly near the outer third. Now do both sides at the same time. Don't try to fix anything. Don't adjust your posture. Just find both bones and notice if they feel the same. The height, the angle, whether one side feels more lifted toward your shoulder than the other. Most people feel a difference. The dominant arm side, the right for most people, tends to sit slightly higher and slightly more forward. Decades of reaching, carrying, driving, typing, holding a phone in one particular way. The clavicle doesn't get to opt out of any of that. It's the bony bridge between the arm and the central skeleton. And every asymmetric load you've put through one arm has been passing, at least partially, through that clavicle and into the structures above it. Let me stay with what that actually feels like for a moment, because I think there's something worth noticing here before we get further into the anatomy. When you find both collarbones at once, both hands, both sides, touching something you've been living inside for decades without ever deliberately feeling, there's often a moment of something uncomfortable. Not pain, something more like recognition, like finding a word for something you'd been circling around for a long time. The bone is right there. It's always been right there. You've been using the arm attached to it. You've been wearing clothes over it. You've been carrying bags on the shoulder it connects to. And somewhere in all of that, it just became background. The way you stop hearing a fan after a few minutes, even though the fan is still running. The clavicle as background infrastructure. That's what it's been for most of us. Something like a load-bearing wall that you've been repainting the room on top of without checking whether the wall is plumb. And here's the thing about load-bearing walls. You can sense when something isn't quite right in a building. Before you understand it structurally, you feel it. A door that doesn't close the way it used to. A window that sticks on one side. Something in the quality of the space that registers before you have the vocabulary for it. The body is similar. The asymmetric lower face. The slightly different quality of one cheek versus the other. That's the door that doesn't close quite right. The collarbone is the thing you'd want to check before you start adjusting the hinges. The 60-second reset I want to walk through now doesn't manipulate the clavicle. It's not a mobilization. It's not an adjustment. What it does is give the structures connected to the clavicle, the fascia above it, the platysma, the soft tissue running toward the neck, a sustained input of pressure at the origin point that allows them to find a different resting length. Schleip's research on fascial response thresholds puts the minimum effective duration for this kind of input at somewhere between 45 and 90 seconds of sustained contact. 60 seconds lands in the middle of that range. Someone sits, back supported, both feet flat. The hands come up, and each set of 2 fingers finds the clavicle on its own side, at the outer third, not at the center, not at the shoulder, the outer third, where the bone begins its curve toward the shoulder joint. This is where the anterior fascial tension tends to be most accessible, and where the platysma's origin is closest to the surface. The pressure is firm enough to feel the bone distinctly, not to move it, not to press through it, but to know where it is. Then, very slightly, the fingers press in a direction that is simultaneously downward and toward the back. Not dramatically. The movement, if you could measure it, might be 2 millimeters. The direction of the pressure is more important than the magnitude. Inferior and posterior. Down and back, not toward the center of the body, not outward toward the shoulder. 30 seconds of holding that contact. During those 30 seconds, the temptation is to check whether something is happening. Resist that. The fascial response doesn't announce itself with a sensation. It's quieter than that. What often happens is that the surrounding tissue begins to feel slightly different in quality. Softer maybe, or, this is harder to describe, less busy. Like the difference between holding a conversation in a noisy room and holding the same conversation after the background noise stops. Then, without releasing the contact, take a breath that moves your chest. Not a forced breath, not a performance of breathing. A breath that actually expands the front of your rib cage, which means the tissue under your fingers and connected to your fingers moves slightly. Do that for 30 seconds. Breathe into the contact. When 60 seconds is up, both sides, simultaneously, the whole time, let the hands come down. Then turn the head slowly to the left, all the way to a comfortable end range. Come back to center, turn to the right. Notice whether the two sides feel different from each other. Notice whether either side feels different from how it felt before you started. For most people, the rotation range has changed detectably. One side that felt slightly tethered now moves a little further. Sometimes both sides move further. The fascial environment around the clavicle has shifted its resting state, even briefly, and the structures above it have registered that shift. This is what I want to be careful about saying clearly and also carefully. That 60 seconds doesn't restructure anything permanently. The body doesn't change its resting state in 60 seconds. What it does is introduce a different input into a system that has been running on the same asymmetric input for years. Repeated inputs accumulate. A single session gives you information. It shows you what the tissue is capable of when it has a different starting point. Whether that starting point becomes the new baseline depends on consistency and on what else is happening in the system around it. The platysma doesn't know you did one reset, but it knows when the conditions above and below it are different over time. The clavicle doesn't restructure, but the tissue whose behavior is influenced by clavicular position does adapt, and that adaptation is measurable. Even 2 or 3 millimeters of positional change in clavicular elevation, sustained over weeks rather than achieved in a single session, alters the resting length of the platysma in a way that changes what the lower face is being asked to do against gravity. What I find myself returning to thinking about this, and I'll admit this is the part I'm still sitting with, is how long the collarbone has been doing its work without being asked about it. Every facial concern, every asymmetry notice in a mirror, every morning where one side of the face looks somehow heavier than the other, and almost none of the attention goes 2 feet down to the structural anchor where the pattern originates. The face gets the conversation, the collarbone gets the jewelry. There's something a little strange about that, a little bittersweet maybe. All those years of the body working with what it was given, adapting to the loads you put through it, compensating at every level from the clavicle upward, and doing a very good job of it actually. The asymmetry you notice in the mirror isn't the body failing, it's the body succeeding at something that wasn't quite the right task. The reset doesn't undo those years. It asks the body to try a different task for 60 seconds and see what it can do with that. What happens in the face after consistent bilateral reset work, after weeks, not hours, is gradual. The softening of the lower face, the shift in how the tissue hangs differently on each side, the quality of resting muscle tone through the neck and jaw. These things change the way sediment settles, not the way a switch flips. Slowly, then noticeably, then permanently, if the conditions that allowed the change are maintained. Both sides equally is not a destination you arrive at. It's a calibration you keep returning to. And if you do this tonight, both hands, both collarbones, outer thirds, 60 seconds, there's a question the rotation test will raise that I haven't answered here, and that I think is worth carrying with you. When you notice that one side rotates further than the other after the reset, what you're feeling isn't just the clavicle's influence on neck rotation. There's another structure involved, one that runs from the clavicle in a direction we haven't gone today. Something that connects to how the rib cage sits under the clavicle and why bilateral facial symmetry has a floor that clavicular work alone can't lift through. That's a different investigation. And it starts with a bone most people have never thought to check for the same asymmetry they've been noticing in their face. For now, the collarbone. Outer thirds, 60 seconds. Both sides at once, because that simultaneity is the whole point. The body needs the comparison to know which way to go. If this kind of anatomical territory, the structural underpinnings of things we've been treating at the surface, is what brought you here, there's more of it coming on this channel. You don't need to miss it.